Let's begin by understanding what a crisis really is. A crisis can be any situation where a person feels overwhelmed and unable to cope using their usual methods. It might be triggered by a traumatic event, sudden loss, or even ongoing stress that finally becomes too much. Recognizing the signs of a crisis is the first step in providing effective intervention. These signs can include intense emotions, confusion, withdrawal, or even risky behavior. By identifying these early, we can respond more quickly and appropriately. In this video, we'll explore practical techniques to help someone in crisis, starting with the basics and moving toward more advanced strategies. When you're faced with someone in crisis, your own emotional state matters. Staying calm helps you think clearly and reassures the person you're helping. Take a deep breath, ground yourself, and focus on being present. Your calm demeanor can be contagious, helping to de-escalate the situation. Remember, you're there to support, not to panic. If you need a moment to collect yourself, it's okay to pause before engaging. This sets the stage for a more effective intervention and builds trust with the person in crisis. Safety is always the top priority in any crisis situation. Quickly assess whether there's any immediate danger to the person or others around them. If there's a risk of harm, take steps to remove dangerous objects or move to a safer environment. Sometimes this means calling emergency services if the situation is beyond your control. Your goal is to create a safe space where the person can begin to regain a sense of stability. Once safety is established, you can focus on other intervention techniques. Listening is one of the most powerful tools in crisis intervention. Practice active listening by giving your full attention, making eye contact, and using open body language. Let the person speak without interruption and show empathy through your words and actions. Reflect back what you hear to confirm understanding, such as saying, "It sounds like you're feeling overwhelmed." This helps the person feel heard and validated, which can reduce their distress and open the door to further support. Approaching someone in crisis with a non-judgmental attitude is crucial. Avoid making assumptions or criticizing their feelings and actions. Instead, focus on understanding their perspective and offering support without judgment. This creates a safe environment where the person feels comfortable sharing their thoughts and emotions. Remember, everyone experiences crisis differently, and your role is to support, not to judge or fix everything immediately. During a crisis, complex explanations can be overwhelming. Use simple, clear language when communicating. Speak slowly and calmly and avoid jargon or technical terms. This helps the person process information more easily and reduces confusion. If they seem unsure, repeat or rephrase your message. The goal is to make communication as easy and stress-free as possible, so the person can focus on coping with their emotion. Validation is a key part of crisis intervention. Let the person know that their feelings are real and understandable, even if you don't fully agree or relate. Phrases like, "It's okay to feel this way," or "Anyone in your situation might feel upset," can be very comforting. Validation helps reduce shame and isolation, making it easier for the person to open up and accept help. Open-ended questions encourage the person to share more about their experience. Instead of asking yes or no questions, try prompts like, "Can you tell me more about what happened?" or "How are you feeling right now?" This invites deeper conversation and helps you better understand their needs. Open-ended questions also show that you're genuinely interested in their perspective, which can build trust and rapport. Crisis can make people feel powerless. Offering choices, even small ones, can help restore a sense of control. For example, you might ask, "Would you like to sit here or over there?" Or, "Do you want to talk now or take a break?" These options empower the person and show respect for their autonomy, which is vital for their recovery and sense of safety. If emotions are running high, de-escalation is essential. Speak in a calm, steady voice and use non-threatening body language. Give the person space if they need it and avoid sudden movements. Sometimes just being present and silent can help diffuse tension. The goal is to lower the emotional intensity so that you can have a more productive conversation and keep everyone safe. Grounding techniques can help someone who feels overwhelmed or dissociated during a crisis. Encourage them to focus on their senses, what they can see, hear, touch, or smell. Simple exercises like deep breathing, holding a comforting object, or naming 5 things in the room can bring them back to the present moment. Grounding helps reduce anxiety and makes it easier to cope with distressing emotions. Remind the person in crisis about the importance of self-care. Simple actions like drinking water, eating a snack, or taking a short walk can make a big difference. Self-care helps stabilize emotions and provides a sense of normalcy. Encourage them to rest if possible and to avoid making major decisions until they feel more settled. Let the person know that their reactions are normal responses to a difficult situation. Many people feel anxious, sad, or angry during a crisis. By normalizing these feelings, you help reduce their sense of isolation and shame. This reassurance can be comforting and make it easier for them to accept support and begin the healing process. During a crisis, big problems can feel overwhelming. Help the person set small, achievable goals like taking a few deep breaths or making a phone call. Breaking tasks into manageable steps can make the situation feel less daunting and give the person a sense of accomplishment. Celebrate each small success to build confidence and momentum. Offering reassurance can be very comforting during a crisis. Let the person know that you're there for them and that things can improve. Simple statements like, "You're not alone," or "We'll get through this together," can provide hope and stability. Your presence and support are often more important than having all the answers. Respecting the person's privacy is essential. Don't pressure them to share more than they're comfortable with and keep their information confidential unless there's a risk of harm. This builds trust and shows that you respect their boundaries. If you need to involve others for safety reasons, explain why and involve the person in the decision if possible. It's natural to want to fix things but avoid giving unsolicited advice during a crisis. Instead, focus on listening and supporting. If the person asks for your opinion, offer suggestions gently and respect their choices. Sometimes just being there and listening is the most helpful thing you can do. If appropriate and welcomed, supportive touch like a hand on the shoulder or a comforting hug can be very grounding. Always ask for permission before initiating physical contact, as not everyone is comfortable with touch. Respect their wishes and find other ways to show support if needed. Physical presence alone can be reassuring. Pay attention to nonverbal cues like body language, facial expressions, and tone of voice. These can tell you a lot about how the person is feeling, even if they're not saying much. Respond to these cues with empathy and adjust your approach as needed. Sometimes, a gentle nod or a soft tone can make a big difference. Being fully present means giving your undivided attention to the person in crisis. Put away distractions like phones or other devices and focus on the conversation. Your presence alone can be incredibly reassuring and help the person feel valued and supported. Staying present also helps you pick up on subtle cues and respond more effectively. Encourage the person to express their feelings in whatever way feels comfortable: talking, writing, drawing, or even just sitting quietly. Expression can be a powerful way to process emotions and begin healing. Let them know it's okay to cry, be angry, or feel confused. Your acceptance creates a safe space for them to open up. Ask about the person's support systems, friends, family, or professionals they trust. Encourage them to reach out to these people if they feel comfortable. Sometimes just knowing they have support can make a big difference. If they don't have anyone to turn to, help them explore other resources like hotlines or community services. Sometimes professional help is necessary. Encourage the person to seek support from a counselor, therapist, or doctor if needed. Offer to help them find resources or make an appointment. Remind them that seeking help is a sign of strength, not weakness, and that professionals are trained to provide effective support during a crisis. After the immediate crisis has passed, follow up with the person to see how they're doing. A simple message or call can show that you care and help prevent future crises. Ongoing support is often just as important as immediate intervention. Let them know you're available if they need to talk or need help accessing resources. It's important to recognize your own limits when helping someone in crisis. You can't do everything, and that's okay. If you feel overwhelmed or unsure, seek support from others or refer the person to professionals. Taking care of yourself ensures you can continue to help effectively without burning out. Be aware of cultural differences that may affect how a person experiences and responds to crisis. Respect their beliefs, values, and traditions, and avoid making assumptions based on your own background. Cultural sensitivity helps build trust and ensures that your support is respectful and effective. Helping someone in crisis can be emotionally challenging. Take time to process your own feelings and seek support if needed. Managing your emotions allows you to remain effective and compassionate. Remember, it's okay to feel affected by what you hear. Self-care is essential for everyone involved. Crisis hotlines are valuable resources for immediate support. Encourage the person to call a hotline if they need someone to talk to, especially outside regular hours. Hotlines are staffed by trained professionals who can provide guidance and connect people to additional resources. Keep a list of local and national hotlines handy for quick reference. If you're in a professional role, document the crisis situation carefully. Record what happened, what actions were taken, and any follow-up steps. Accurate documentation helps ensure continuity of care and protects everyone involved. Always respect privacy and confidentiality when recording sensitive information. Work with the person to develop a safety plan if there's a risk of harm. This might include identifying warning signs, safe places to go, and people to contact in an emergency. A clear safety plan can provide reassurance and help prevent future crises. Review and update the plan as needed to keep it relevant. Empower the person in crisis to make their own decisions whenever possible. Offer information and options, but let them choose what feels right. This supports their autonomy and helps rebuild confidence. Even small decisions can make a big difference in restoring a sense of control. Many crises are rooted in trauma. Be sensitive to signs of trauma, such as hypervigilance, avoidance, or intense emotional reactions. Trauma-informed care means understanding how past experiences can affect current behavior and responding with empathy and patience. Avoid triggering language or actions and focus on creating a sense of safety. Positive language can help shift the focus from problems to solutions. Use encouraging words and highlight strengths such as "you've handled tough situations before" or "you're showing a lot of courage." Positive language fosters hope and resilience, making it easier for the person to move forward. Be mindful of potential triggers that could worsen the crisis. This might include certain topics, environments, or even specific words. Ask the person if there's anything they'd like to avoid and respect their wishes. Avoiding triggers helps create a safer, more supportive environment for recovery. Relaxation techniques like deep breathing, progressive muscle relaxation, or guided imagery can help reduce anxiety during a crisis. Offer to guide the person through a simple exercise or suggest resources like apps or videos. Relaxation helps calm the body and mind, making it easier to cope with stress. Journaling can be a helpful way for someone in crisis to process their thoughts and feelings. Encourage them to write about their experiences, emotions, and any steps they're taking to cope. Journaling provides a safe outlet for expression and can reveal patterns or triggers that need attention. Mindfulness techniques such as focusing on the breath or observing sensations without judgment can help someone stay grounded during a crisis. Encourage the person to try mindfulness exercises even for a few minutes. Mindfulness can reduce stress, improve emotional regulation, and promote a sense of calm. Visual aids like diagrams, lists, or drawings can help clarify information during a crisis. Use simple visuals to explain steps, safety plans, or coping strategies. Visual aids make complex information more accessible and can be especially helpful for people who struggle with verbal communication. Encourage the person to maintain healthy routines such as regular meals, sleep, and physical activity. Routines provide structure and stability, which can be comforting during a crisis. Help them identify small, manageable steps to get back on track if their routines have been disrupted. Sometimes, addressing basic needs like food, water, shelter, or sleep is the most immediate intervention. Check if the person has access to these essentials and help them meet any urgent needs. Meeting basic needs can significantly reduce distress and create a foundation for further support. Social connection is a powerful protective factor during a crisis. Encourage the person to reach out to friends, family, or support groups. Even a brief conversation or message can help reduce feelings of isolation and provide comfort. Social support is key to recovery and resilience. Humor can sometimes lighten the mood, but use it carefully and only if the person seems receptive. Avoid making light of their situation or using humor to deflect serious emotions. When used appropriately, gentle humor can build rapport and provide a brief respite from stress. Recovery from a crisis takes time. Be patient with the person and with yourself. Progress may be slow and setbacks are normal. Offer consistent support and encouragement and celebrate any steps forward, no matter how small. Patience helps build trust and fosters long-term healing. After a crisis, take time to reflect on what went well and what could be improved. Learning from each experience helps you become more effective in future interventions. Seek feedback from others if appropriate and continue to build your skills and knowledge in crisis intervention. Crisis intervention is about providing support, safety, and hope during difficult times. By using these techniques, staying calm, listening actively, validating emotions, and empowering choices, you can make a real difference in someone's life. Remember, you don't have to have all the answers. Your presence, compassion, and willingness to help are often the most powerful tools you have. With patience and care, recovery is possible.